Hey everybody, it's Ken again with episode 2 of my Lyme, MS, chronic inflammatory disease treatment video blog. I kind of wanted to let you know that this video will cover the last 2 weeks of my treatment, weeks 2 and 3. I did not get a chance to record a video last weekend because I was in pretty sad shape. And I'll go into why I was in sad shape here in a little while. But I wanted to start off by saying that it's been really, really cool to be able to continue to meet new patients and to meet returning patients, patients that are coming back for their yearly follow-ups or coming back for maintenance on their treatment and things like that. I've met a lot of really cool people from all over the United States and a couple people from outside the United States. A person from Kenya has come and gotten some treatment, a return patient. And, it's just been really, really neat to meet people and to be able to share information and be able to offer support and receive support from them. It's been a really, really great experience so far. And the nurses and the doctors that are running the clinic, these are some of the most professional people that I've ever had the pleasure of meeting, and getting to know them kind of in a not only a professional way but a personal way too. I mean, because they really they want to be close to their patients. They want to make you feel, part of that psychological treatment is making you feel welcome and making you feel at home and all of those things. And they're so good at it. So I just want to give a shout out and say thanks to everybody that's working there at the clinic. You guys are just doing a great job. The focus of this video, I want to kind of focus on some of the main treatment tools that the clinic uses to treat inflammatory illness. The first one of those, and they all basically kind of build on each other or rely on each other, or all kind of interrelated. The first major tool in the toolbox that they use for treatment is called the glyoxal shot. And the glyoxal shot is a shot that they give you in the buttocks, and it does not feel very good at all. As a matter of fact, it hurts like a mofo for about 20 seconds. But you got to get it every day. It's an everyday injection, and it's part of what sets the stage for the next part of the treatment. The glyoxal shot, when it's given to you, it superoxygenates the body, creates a very aerobic environment in your tissue of your muscle tissue. I mean, everywhere in your body, it creates a very aerobic environment. And whenever pathogens are confronted with a very aerobic environment, they have a hard time because they don't like oxygen. Pathogens typically enjoy an anaerobic, oxygen-deficient, acidic environment. And so if you're creating a alkaline, aerobic environment, pathogens have a difficult time existing in that. So creating that environment is already a very important step in taking the next step, which is attacking and destroying and getting rid of pathogens. So the glyoxal shot kind of sets the stage for the next big tool in the toolbox, and that is the push. It's also referred to as a mitochondrial DNA culture, or mitochondrial peptide therapy, or it has several different kinds of names, but the nurses and the patients all refer to it as the push. And as I said, the push is basically a culture of a mitochondrial DNA from a seaweed called chlorella. And the clinic cultures this stuff each week. Sometimes it's a strong culture, sometimes it's a weak culture. It just kind of depends. So when you're getting your culture, your push injection, they start small in terms of dosage and work their way up. And the whole goal is to induce the push reaction. Okay, so essentially, when you get your push, it supercharges the mitochondria of the cells in your immune system, your T cells, your B cells, your neutrophils, your lymphocytes. Everything that works in concert to protect the body from infection, it supercharges it. Okay? And the goal is to give you just enough of this stuff to trigger the push reaction. When the push reaction happens, it happens because your immune system has been jazzed up. Okay? And once it reaches a certain point, the immune system goes hunting. It's like, hey, let's go hunting, let's go find the bad guys, let's go get them. And that's exactly what it does. And so if you're fighting a systemic, chronic, inflammatory type infection, your immune system begins to key off, and it begins to find this stuff and kill it and destroy it. And if it's something like Lyme disease, and I haven't quite gone into this, and talked about it yet, but Lyme disease has a tendency to hide in the cells of your body, protected from your immune system. Well, whenever you have a push and you have a reaction, the immune system is strong enough to sort of draw this stuff out. And when combined with a highly oxygenated environment generated by the glyoxal shot, a lot of this stuff is stirred up and pushed out and out in the open and vulnerable, so the immune system can attack it. And so that's what it does. Now the push reaction is an interesting thing. Usually it will hit you anywhere from 30 minutes to 3 hours after your push, and can take the form of mild to very severe flu-like symptoms. For me, my pushes take the form of severe muscle contraction and shaking. And that is normally in a very good push reaction for me. It usually lasts about 45 minutes of shakes, and then that sets into sweats and the feverish type feeling. The nurses in the clinic refer to this as the shake and bake. And the reason that I did not record a video last week was because the push that I had on Thursday before the weekend, it left me basically on the floor of my dining room, completely incapacitated for 14 hours. I had to have someone from the clinic to come out and basically put IV bags in me to rehydrate me in order to get me off the floor and get me back into the clinic for Friday's treatment. And it was very, very severe and left me in very bad shape, for Friday and Saturday. Now, I'm not trying to scare anybody, okay? I mean, as long as you have a caregiver or someone with you during your reactions that can help you if you have a lot of difficulty, it's the best way to go. I wouldn't recommend doing any of this on your own, because if you're really suffering from a serious illness, your push reactions can be severe. So you'll always want to make sure that you've got somebody there to help. And I just want to put a shout out to Charlie. Buddy, you're my hero. You're my angel. I love you, man. Thank you for what you did. I appreciate it. So anyway, when the push reaction ends, your body is left with all of the die-off and all of the leftover toxins. So this kind of opens up the avenue for discussion about detoxing. The systems of the body that work to clear this stuff out is your lymphatic system, your liver, and your colon. Okay? So if any of these systems are disrupted or impaired or compromised, you really have to have those things addressed. And this revolves around having, lymphatic drainage type techniques performed on you, having liver detoxes done, having colonics done. You want to make sure that all of these avenues of elimination are open and available to the body and not compromised. because if you have a severe push reaction and your body cannot get rid of the toxins that are left over, you're going to be in trouble. So when you're here at the clinic, that's one of the main things that they stress, is getting these things taken care of and working properly before they're pushing you with any kind of big dose of this mitochondrial solution. So that basically covers just about everything I wanted to talk about this time. Next week's video, I'd like to probably talk more directly about Lyme disease and testing and why testing is flawed. But I guess the reason I wanted to talk about the mitochondrial push and things of that nature was because of my severe reaction that I had last weekend. I wanted to kind of explain why I didn't have a video up. So anyway, with that, I hope you guys, right now it's Saturday, I hope you all have a great weekend and a great week, and I will check in with the new video next weekend. So everybody take care. See ya. Bye.